Transfusion Risk Group (TRG) summarizes the patient's blood transfusion-related story. TRG classifies patients based on demographics, clinical, and laboratory data. Demographics include gender, age, and race. Special attention is given to young women whose alloimmunization prevention is targeted to prevent hemolytic disease of the fetus and newborn. Clinical contains diagnosis, chronic transfusion of blood components, and use of anti-CD38 monoclonal antibodies. Special attention is required for recipients with blood system diseases and long-term transfusion therapy, who need the selection of RBCs for the prevention of hemolytic transfusion reaction. Recipients using drugs that cause nonspecific RBC agglutination require extended phenotype matching donor selection. And laboratory. Presence of specific antibodies, nonspecific antibodies, and multispecific antibodies. If specific alloantibodies are detected in the recipient, the selection is carried out using RBC of the phenotype, where there is no antigen to which the patient's antibodies are directed. If nonspecific or multispecific antibodies are detected, the selection is performed according to the extended phenotype matching principle. The TRG approach is designed to prevent recipient alloimmunization by supporting phenotype-based donor selection. TRG groups patients and defines the antigens required for patient-donor matching. There are 7 defined risk groups. Group 1, Group 2, Group 3, Group 4, Group 5, Group 6, and finally Group 0. TRG facilitates the phenotype-matched RBC selection, and this is essential for the IHF's matching method. TRG powers the immunohematology framework IHF, a universal operating model for the blood transfusion domain.